ASH attendees got the inside scoop on the FDA's approval process in 2 ASH-FDA joint symposia. The first session focused on targeted gene and cellular therapy and addressed recent approvals in classical hematology.
One of the biggest issues that came up at this session was the cost of gene therapy. But again, like Dr. Verdun said, we need to get the input from many different stakeholders so that we can make this therapy accessible to all of our patients.
A very recent approval in terms of Friday, 2 gene therapies for sickle cell disease, and specifically one with CRISPR-Cas9 technology, which is the first therapy using this gene editing tool. And so it's just been an exciting time.
The second session focused on malignant hematology.
We really want people to get an idea of the risk mitigation strategies we're using at the FDA, including use of the U.S. prescribing information, more commonly known as the label, and also the use of risk evaluation and mitigation strategies, or REMS programs, for agents that have a potential for benefit but with a significant risk profile.
As we continue the conversation around the FDA's approval of the first gene therapies to treat patients with sickle cell disease was announced on Friday, just as the annual meeting was kicking off. We spoke with hematologists about their reactions to this announcement and, most importantly, how we'll continue to move the needle in conquering sickle cell disease.
Well, I think the most important thing about gene therapy is that everybody is followed by a sickle cell disease center. Many individuals are followed in the community, and there are a lot of transplant centers interested in doing gene therapy for sickle cell disease. I love my transplant colleagues, but they need to make sure they're working hand in hand with a sickle cell disease specialist. People with sickle cell are not the same as people with myeloma, who they've been doing autologous transplants for a long time. So following these individuals in sickle cell disease centers is incredibly important. And then making sure they get those patients back for ongoing long-term follow-up is going to be key.
The Ernest Beutler Lecture and Prize recognizes major translational advances. We spoke with this year's honorees about their respective work that earned each of them this prestigious recognition.
I'm very glad to receive this prestigious award. Actually, it's very amazing for me. Now, I'm standing here. It's really amazing. I'm very happy and I'm proud of receiving this award on behalf of my excellent colleagues.
The content of my lecture is translational medicine. It's taking the development of the factor VIII mimetic and putting them into clinical context. I'll first describe the unmet needs of patients with hemophilia, and then I'll go on to summarize the data that has accumulated to date in terms of pharmacokinetic safety and efficacy, and very briefly I will speculate on what the impact of this is going to be in the future in the community.
ASH is at the forefront of addressing a critical health equity concern through its practice-changing initiative, the reconsideration of absolute neutrophil count reference ranges by Duffy status as shared during Monday's Spotlight session.
There is an initiative by the American Society of Hematology that's being sponsored by Doris Duke Foundation to involve institutions, physicians, and individuals who have Duffy null-associated neutrophil count in better understanding this the condition, which is not an abnormality, and also in changing or improving our reference ranges so that we do not pathologize individuals who do not have a condition that makes them sick.
The Scientific Committee on Hemostasis is focused on the blood clotting system's role in hemostasis and also in inflammation and cancer biology. Topics of importance to all hematologists that were addressed during Monday's session on basic science in hemostasis and thrombosis.
All of these 3 sessions work in the field of the hemostasis and thrombosis. It always does a question how we can interfere with the process of the thrombosis without impacting the hemostatic response. The main idea is to block thrombosis without increasing bleeding risk.